Okay, so our knights are back. They have all of their wisdom collected, and they're going to share it with us. We've got until a maximum of 150, but apparently they're not going to need that long. So we'll turn it over to critical listeners, and they're going to go through each of the programs as we said. All right.
Okay, so good afternoon. My name is Bethune-Davies, and
I'm Barbara Dobson.
Marlys Koschinsky.
I'm Lauren Kennedy.
so we're going to present our feedback as a collective here, and I'm going to start by telling you that we were tasked with a very difficult job, as probably evidenced by running over time, because we felt that all of the presentations had value, and it was very difficult to assign numbers to things, and so we're doing our best. We want to give a disclaimer, as Lauren would say. We're going to do our best to give you our feedback, and so hope you'll bear with us, and I'll start. So I'm giving the collective feedback for the first presentation, which was looking at the pediatric population that has had an identified gap in service from a registered dietitian. And we thought that that was an excellent topic that had a lot of value since nutrition is so vital in children aged 0 to 5, and particularly in the vulnerable high-risk group that you had identified. We thought that definitely children in this vulnerable group, and maybe all children in that age group of 0 to 5, should have accessibility to the expertise of a registered dietitian. We thought there was definite potential. It was a gap that was identified from the community, and we thought there was a good potential for a partnership with research and with academia. But we were a little unclear about the design. We weren't sure who would be involved, if it was something, a study that was going to be done just in London, or if it was something that would be done throughout the LIN. And we weren't sure why the gap, and I know that part of the research that you're proposing is a gap analysis, but we weren't quite clear about why these children had been denied access. And so we wondered if you had considered the primary care sector that employs registered dietitians, if these children had access to primary care providers. So we just thought that it might be a little stronger if the design was a little bit clearer. Have I captured that?
I think you captured it very well.
Okay. I'll pass this on to...
Yes, I'm going to print too.
I want your job. No, you're going to be saying something. Okay, so I'm here to present the collective discussion around the presentation that we heard, Losing Weight the Healthy Way. And that was presented by Karen Belmore and Heather Nadon from the Windsor Essex County Health Unit. So just to provide the context then for this, the Health Unit has been offering a program for, I think, for at least 10 years, as I recall. And certainly it's important for adults. It addresses the very critical area of improving behaviors related to health, lifestyle, and in fact how those can be affected through healthy eating and exercise. And the goal ultimately is sustained weight loss. So the proposal really, as we heard, focuses on moving the delivery of the program from an in-person setting to an online format. And again, we recognize that that has great potential to increase the accessibility of adults to the program, and also to address some of the challenges and the barriers with respect to fees for the program, because my understanding is that that online version would be free. So again, certainly there's no doubt that the project has potential to improve patient and population health, and certainly increase our knowledge about the efficacy of interventions designed to address those issues. So the question really is the online format the best format with respect to delivery of this type of an educational program? So the areas that we thought that the group might consider, and again, we saw a lot of merit in the proposal, but perhaps, it's at this point targeted to Windsor, Essex. Of course, if something is going to go online, the argument is it's inaccessible to the world. So really, perhaps in the design of the online format, consideration of, that this could be certainly something that could benefit our region as a whole, would be taken into account. We also wondered about issues around accessibility of adults to computers and even their tech savviness, speaking as a well-seasoned adult, oh thank you, and an educator myself, but also a well-seasoned adult. I know that our university students, the younger age students coming in from high school are very tech savvy. We don't worry when we create online courses whether or not they're going to be able to manage, if we want to put a Skype component or we want to have a chat room or something. But again, those are all things that, we just really felt as a group that need to be taken into account when you're designing the online format. And also very critical to the success and sustainability of this project is how that you're going to define the metrics and the measurements for your success. How are you going to look at, it would be nice to sort of go back retrospectively and say, what is the last 10 years of the program? What have the wins been? Where have the problems been? And then as you're going to the online format, how are you going to compare that in terms of the success relative to, again, the in-person presentation? Certainly there's a lot to be said about online with respect to anonymity, but there's also a lot to be said about group support. So again, in the design of the online version, it would be good to have some way to allow people to interact still. And again, that sort of brings in that level of tech savviness that maybe adults might find challenging. I do also encourage the group to consider an academic component more to this in terms of partnerships. Say with the university, for example, we're always moving in the direction of providing online education to adult learners, and we recognize that that's a special and different group, and there's plenty of expertise at the university. We'd be glad to work with you and the college as well, I'm sure, in making sure that that program is as good as it can be in the online format, and looking at some of the learnings that we have, again, in our continuing education efforts at the university and at the college as well. So thank you very much for sharing your presentation with us today, and we hope that you find our feedback helpful. Thank you. Next, who am I introducing? Who's going next? Oh, it's me again. Let me introduce myself again. Oh, two educational ones. Okay, well that was good planning. So I'm now going to say a few words again, reflecting the discussion of the group around the presentation, nutrition education, in the pharmacy curriculum at the University of Waterloo School of Pharmacy for the PharmD program. And I really found this presentation, I guess I'm biased as an educator, but I found it was elegant, it was very nicely presented, and we heard really nice stuff, just kind of things I like to hear about integration of the Waterloo Pharmacy required courses being integrated, how the learning outcomes sound really, really effective and well thought out. The program really sounds amazing, full of innovation in the curriculum, integrated learning strategies, forward-thinking ways to prepare pharmacists to better serve the community with respect to questions that they will get in today's age, that everybody has the internet. Everybody knows the next best natural health product that can basically allow them to discontinue their statin and jump on something else. And I know what my mother asks her pharmacist, so I have a pretty good handle on what the community expects pharmacists to know and be able to provide direction on. So I really enjoyed the presentation. And we felt that certainly this area has great potential. We really encourage to focus on a research question, and I think one came up in the discussion that followed the presentation about really asking the community a little bit more about what would you like your pharmacists to be able to help you with, or what do you expect them to know? How do you expect them to help you, as part of your healthcare team? So we felt that there was a lot of opportunity there, and to think also maybe about opening up this wonderful training, maybe even in a modular way. Could we be getting this out to, so that we could kind of help maybe in a continuing education way again for existing pharmacists in our region to get, add some of this great stuff that you've got in your curriculum. And so I think there's a lot of opportunity there. And you were talking about health sciences programs that, Waterloo doesn't have a particularly strong health sciences program. I think those were the words that were used. But having said that, there are lots of health sciences programs around. And there's some, we've got one, London, Western has, a strong one, MAC has one. So again, there's lots of programs that could, again, modules from this, perhaps in an online format, be integrated into some of these existing health sciences programs as a complement to the existing training. So I thought there was just a whole lot of things that could be done and really encourage further development of this with a focused research question, because there's a lot of great things, I think, and a lot of potential here. So again, the group thanks Dr. Richard for her elegant presentation and thought-provoking curriculum development. Who am I introducing now? Not if you say me again, I'm sitting there. It's Lauren. Lauren Kennedy. Here you go. And you got to take the microphone.
Thank you. So the first presentation that I'll be talking about is the Let's Go program, presented by Dr. Dennis and Zoe. And so our group felt that this presentation and this project had a lot of value. The serious mental illness population is an important population, and the SWAHN program has shown some clinically significant impacts. And so this project would be looking at the transferability of that research to this particular population. So we were looking and interested to learn more about what population this study was done in, and some more specifics about the research. We had hoped to look up the paper ourselves, but we had a very limited amount of time. So, but we were interested in looking more about the transferability of this to this population, and how are the two populations different, and how would that merit the research done in this population with serious mental illness. We found that the project seemed to be based in evidence, and one of the strengths also was partnership between the academic institution and the community. So looking at using medical residents and having that partnership there is a strength that does align with SWAHN's objectives. We were also interested in, or wanted to recommend, considering linking patients from the tertiary care setting into transition, and what programs are already existing in the community that this could be linked to or partnered with. So that was one suggestion that we came up with as a group. Another strength was involving the staff in research. So it was mentioned that there hasn't been a lot of research emphasis in this particular hospital, so this project could be a way to do more of that. Yeah, is there anything else to be added? All right, so yeah, thank you again, great presentation, really, really interesting project. The next project that I will be talking about is the Probiotic Yogurt project, so Western Heads Home. That was presented by Charlotte Coleman. So again, thank you very much. Very valuable topic and very interesting presentation. Another thing that we talked about in this presentation that we liked was, again, the partnership between academic settings and the community. So how Brescia and Western could be involved in setting up a program that works with youth in the community in London and helping to equip them with skills to create probiotic yogurt. And this would be transferring research that has been done from Africa and looking at how it could impact the population here in London. And so one thing that we would recommend looking into would be the heterogeneity of the microbiome. So this was a comment that was raised. So looking at how there are many different kinds of bacteria, and different bacteria's different strains of probiotics have different impacts on the body. So we would have been interested also to hear a bit more about the magnitude of the impact of this particular strain, so the lactobacillus strain, on diabetes and obesity, which were the two diseases that we targeted. But again, great presentation with a lot of great potential health impacts for students in London or for youth, as well as the potential for skill building. We also looked at the transferability. So the whole purpose of this project is that there were some great health impacts seen in Africa, and we can't assume that those would apply here. So that is why this project is needed and why research is needed to see if those impacts are in fact transferable. The other thing that we would, or some other questions that we had about the project, were in terms of the current products existing on the market. So one of the comments that was made by Charlotte was that in current yogurt, there isn't always a monitoring system of the probiotics in stores, whether or not the bacteria is still active and living, or whether or not it's actually alive. And so we were just wondering more about how this program would address that, and how that would be addressed in terms of delivery of this product. And again, next steps in terms of business plan was an area identified as a next step to look at as well. So again, very innovative presentation, a really great opportunity in this area. Thank you. Next, Barbara will be talking about the last presentation.
Hello everybody, I'm speaking to the final presentation, the Ontario Student Nutrition Program, presented by Stephanie Segav, I hope I'm saying that right, and her affiliation is the BON. To the issue, does the project address the objectives of SWAHN? We really felt it did, because it's such a wonderful community initiative and area initiative. Certainly, there's no question in dealing with an issue like this with school-aged children. We assumed you were dealing with elementary school-aged children, not high school. Has very broad-reaching impact and a very, very important demographic, in that when we educate on nutrition, our school-aged children, we're working from the ground up. And as a parent, we all know the value of our children in school bringing their education home. I remember brushing my teeth and leaving the water running when my children, who are well beyond that now, but were in elementary school, saying, "Turn the tap off, Mom, you're not conserving water." So I assume that if the children in school become more aware of the value of eating produce and produce, whether dehydrated or fresh, if they take that home, that's always a value too. We know a lot of adults who don't eat very well. So we really felt you have a very valuable project here. You mentioned the lack of Canadian-based research, so that's an area for growth, I would say. And certainly when you commented about us being the only G8 country that doesn't fund this kind of thing, it's not the best comment on our government, I guess. We like the fact that you have collaborated several groups under one brand. We feel there's very strong potential to address the objectives of the symposium. It's a universal program with a goal for population health. I'd like to comment, I guess it fed into what I said earlier about the mom thing, oh, my kid won't eat that. And you found that they did, in fact. And certainly with school-aged children, the peer influence piece is so important. This is good stuff to eat and not that stuff from McDonald's. Knowledge about nutrition initiatives is vital with children, and health lies within those personal lifestyle choices. We like the partner, or the potential for partnering with academic institutions that was suggested, I think, in a question by way of student projects, and that would build in the sustainability of your project. Your foundation is there, we felt as a group, to take this forward in research. We liked your partnering with the dehydration group, and we feel you are mobilizing volunteers well and have a great thing going here. Thank you.